Hi everyone, this is my presentation on information technology in healthcare. Health information technology is technology used to promote the health and well-being of patients and the community. This can include information on health promotion or personal health information. It is very important as technology increases in clinical settings and federal regulations are brought on for these. This is also very important as consumers have access to their own health data and as they become more curious about their health care. And this is very important with the increase in use of electronic health records, mobile applications, patient portals, and telehealth. Electronic health records and patient safety. Electronic health records have 8 key attributes: health information and data, results management, order entry and management, decision support, electronic communication and connectivity, patient support, administrative processes, and reporting and population health management. Electronic health records help to increase communication between the interprofessional team. The interprofessional team can access the same data and be on the same page and can communicate quickly to facilitate clinical care decision making. This also helps to improve clinical decision making and safety. Staff can access past medical history, allergies, lab results, current medications, and relevant forms easily and efficiently. Critical lab values and results are flagged for easy viewing, and due procedures and medications are also flagged in red for easy viewing. This helps to increase quality of communication and care delivery. On administrative levels, this helps to make scheduling, billing, and insurance easier. Electronic health records also increase patient access to their own health information and health education and promotional materials. This helps to increase data access on an individual and a community level. Clinical decision support and computerized provider order entry. Clinical decision support are computerized alerts and reminders to enhance health and healthcare. They can be used by clinicians, staff, and patients. These can be alerts for high-risk drugs, dosing, allergies, critical lab values, and immunizations or screening. For example, a nurse can be alerted if a critical lab value comes back as it's interpreted, which can help with a quick response time. A patient can also be alerted if they're due for a screening, such as a mammogram. Computerized provider order entry allows providers to submit orders for medications, labs, and imaging electronically. This can prevent lost orders and errors. For example, there is that classic joke about illegible doctor handwriting. With electronic orders, this would not be an issue. This also helps to prevent duplicated imaging tests and labs, saving money and cost of healthcare. Rather than relying on a written or fax service, the providers can submit electronic orders quickly and efficiently, which improves efficiency and safety. A clinical example could be a patient having a headache. The nurse could message the provider for a PRN order of Tylenol, and the provider can submit this quickly and electronically so the nurse can give the patient the pain relief medication. Here are some real examples of information and communication technologies in care settings. PerfectServe is a clinical communication tool used by nurses and providers for physician scheduling and communication of urgent data. For example, if a patient has a critically high blood pressure, a nurse can message the provider and ask for a medication to control the blood pressure. Epic Electronic Health Records is a digital healthcare record system accessible by the healthcare team to look through past and chart current data. Epic MyChart is the patient version of this and provides patient access to results, scheduling, billing, and their medication record. Finally, Amwell is a telehealth platform that allows for patient and provider appointments and is highly used for mental health services and urgent care. eHealth, mHealth, and telehealth. eHealth are electronic systems that record, process, and communicate patient data. This could be like the Epic system. This includes data sharing and security between systems to help improve communication, access, continuity of care, and safety. mHealth is the use of wireless technologies to provide healthcare info and services. This could be used by clinicians or patients. This includes smartphone apps, insulin pumps that connect to electronic devices, pulse oximeters, point-of-care monitoring devices, and wearables such as smartwatches. The patients and team can help to monitor data via these, and it helps to get patients more involved in their care and improves communication. Telehealth is the use of communication technology to assess, diagnose, and treat patients. This could be done via phone conversations, interactive videos, or even teleconferencing such as on Zoom. This can help improve healthcare access to rural, older adults, and prisoner populations. Multimedia applications in healthcare. mHealth apps allow patients to schedule appointments, communicate with providers, follow healthcare plans, and get medication reminders. They can help track their health trends or monitor fitness, such as weight loss goals or blood pressure goals. Apps can also sync with wearables for easy tracking. Patient portals are easily accessible electronic health records for patients to access their health info. This helps to improve communication, access to data, and health promotion. For example, patients can track their pulse, blood sugar levels from glucometer data, their menstrual cycle, blood pressure trends, and nutrition, and this data can be transmitted to their healthcare team. Interoperability is crucial with electronic health records. Interoperability is the ability to share and transfer patient data across systems and is essential to protect cost and quality of care. Say a patient goes to a Genesis hospital 1 week and then a month later goes to a Trinity hospital. Well, Genesis might use Cerner and Trinity might use Epic, and so this interoperability helps both healthcare teams from each hospital access the same data. To protect this continuity of care and prevent lost information, the Centers for Medicare and Medicaid Services have a program called the Promoting Interoperability Program, which incentivized hospitals and providers to use certain electronic health records to promote this sharing of information. The federal government and health insurance plans are the biggest influences on electronic health record adoption and integration. Along with prioritizing this interoperability, EHRs must protect reliability, confidentiality, privacy, and security of information, and meet CMS and OTC standards. Legal, ethical, and regulatory responsibilities. HIPAA of 1996 helps to regulate the privacy and security of clinical and patient data at a federal level. The HIPAA privacy rule enforces signed authorization for disclosure of personal health information and prevents information blocking. This means that outside of the essential healthcare team, patients can choose who they want to disclose their personal health information to. Information blocking prevents hospitals and staff from withholding information from patients. HIPAA violations such as withholding information that the patient requests or sharing this information with parties that are not disclosed to receive this information may bring criminal or civil penalties. Organizations and employees are held accountable to these standards. Responsibilities of the nurse include not sharing their own passwords and locking their monitors after they use them, and only sharing necessary info and with the correct team. There often are audit trails to ensure the proper use of electronic health records and to ensure that staff aren't going into charts that they should not. Patient rights and data access. Like we talked about before, mHealth includes patient portal apps and sites that can help the patient monitor health trends, view results from appointments, and securely sign things electronically. Home monitoring can often be transmitted directly to this electronic health record. Therefore, these portal apps and sites must be HIPAA compliant and often use birthday verification and two-factor authentication on a mobile device. Patients also have the right to see and receive copies of their records and can request amendments to their health records through HIPAA regulations. Nurses can help to educate their patients on these rights and give them instructions on how to use patient portals and have more autonomy over their care. They can also recommend online or in-person tutorials on patient portals if patients are really struggling. This access of care helps to improve the quality of care, data access, communication, and patient involvement in care. Future trends in technology. Technology is evolving rapidly, and that includes in the healthcare setting. Advancements in AI, technology, wearables, and gene therapy are increasing every day and are helping patients become a member of their own healthcare team. Such as with AI, wearables, and home monitoring systems, patients can monitor their blood glucose continuously and blood pressure daily and transmit it efficiently into electronic health records for clinicians to interpret. AI helps the healthcare team interpret data and accomplish tasks, highlighting critical values. Benefits of this include the general public having an increased access and availability to devices and internet, and just having increased access to care and efficiency with mHealth and telehealth. Concerns include a lack of social media regulation and people taking healthcare advice from these social media sites. However, further regulations have been put in place to identify trustworthy versus untrustworthy sources. Further research also must be done on evidence-based practice regarding mHealth apps and regulation. It is crucial for nurses to be involved in healthcare technology development. Nurses provide direct patient care, record data, view results, and monitor trends as a part of their day-to-day job. Nurses can bring ideas on how to improve current technologies and identify existing gaps to improve efficiency. Nurses can help to test and evaluate technologies during clinical practice throughout their day-to-day lives. This can ensure that EHRs are comprehensive while also being efficient and user-friendly. Information technology helps to make communication and documentation of healthcare information seamless while identifying critical values, tasks, and trends, helping the nurse deliver care with quality and efficiency. Here are my references, and thank you so much for watching.